Dr. Willoughby Britton, a clinical psychologist and associate professor of psychiatry and human behavior at Brown University Medical School, appeared on the Tim Ferriss Show to discuss her research on the effects of contemplative practices, particularly meditation, on the brain and body in the treatment of mood disorders, trauma, and other conditions. Dr. Britton is best known for her research on adverse effects of meditation, why they happen, and how to mitigate them. Dr. Britton's interest in meditation was sparked by a personal crisis when a childhood friend committed suicide. She turned to meditation as a way to manage her emotions and found it to be a practical way to work with her mind. This experience led her to study altered states of consciousness in a clinical psychology program and eventually to conduct research on the effects of meditation on sleep. One of the surprising findings from her research was that meditation was associated with increasing cortical arousal and insomnia in some individuals. This led her to question the assumptions and marketing around meditation as a relaxation technique and to delve deeper into the history and background of meditation practices. Dr. Britton's research led her to found Cheetah House, a nonprofit organization that provides evidence-based information and support for meditators in distress, as well as meditation safety trainings to providers and organizations. She emphasizes the importance of understanding the potential risks and challenges associated with meditation, as well as the need for more monitoring and off-ramps for individuals who may experience adverse effects. In her research, Dr. Britton found that nearly half of the U.S. population has meditated at least once, and of these people, 6 to 4% had lasting negative effects. She also found that 10% of people who had tried meditation even once had a meditation-related adverse effect that was associated with impairment in functioning. One of the challenges in mitigating the risks associated with meditation is the difficulty in screening out individuals who may be more vulnerable to adverse effects. Risk factors such as trauma history, psych history, and chronic stressors can increase the likelihood of adverse effects, but they do not necessarily rule out the potential for negative experiences in meditation. Dr. Britton continues by discussing the concept of indicator lights in the context of meditation. She explains that individuals often experience specific physical, emotional, or cognitive indicators that signal stress or dysregulation in their system. These indicators can vary from person to person, and it is important for individuals to be aware of their own unique signs of distress. Dr. Britton emphasizes the importance of recognizing these indicators and taking appropriate action to address them, rather than pushing through and continuing with meditation practices that may be exacerbating the problem. She also highlights the potential impact of diet on meditation-related challenges, noting that certain dietary factors, such as fasting or consuming light vegetarian meals, can contribute to dysregulation for some individuals. Dr. Britton suggests that understanding the relationship between diet and meditation experiences can be beneficial in managing adverse effects. The conversation then delves into the neurological and psychological aspects of meditation and the potential for adverse effects. Dr. Britton explains that certain forms of meditation can lead to downregulation of the limbic system and heightened dissociation, which may result in a decrease in the intensity of emotions, known as anhedonia. She also discusses the overlap between altered states induced by meditation and those induced by psychedelics, highlighting the potential for similar adverse effects in both contexts. Dr. Britton emphasizes the need for individuals to be mindful of their goals and intentions when engaging in meditation practices. She encourages people to be aware of the implicit values and goals associated with specific meditation traditions, and to consider whether those align with their own needs and aspirations. Additionally, she stresses the importance of recognizing the power dynamics at play in meditation systems and the potential for trauma associated with feeling powerless or lacking agency in one's practice. The conversation then shifts to the topic of scaffolding, which refers to the process of helping individuals recover from meditation-related challenges and develop alternative practices that support their well-being. Dr. Britton explains that for some individuals, traditional meditation practices may be triggering or inaccessible, and it is important to explore alternative resources and activities that can provide similar benefits without causing distress. The conversation also touches on the similarities between near-death experiences and mystical experiences reported by users of higher-dose psychedelics. Dr. Britton shares a fascinating story about a near-death experiencer who had a vision of future technology which later turned out to be a real innovation in the form of smart glass. This anecdote sparked a discussion about the interconnectedness of different altered states of consciousness and the need for open-mindedness when exploring these phenomena. Additionally, Dr. Britton discusses her experience presenting her research to the Dalai Lama as part of the Mind and Life dialogues. She shares that the Dalai Lama's response to her research was dismissive and not particularly compassionate, highlighting the challenges of addressing adverse effects within traditional meditation communities. Overall, the conversation underscores the importance of approaching meditation and mindfulness practices with a balanced perspective. While these practices can offer numerous benefits, it is crucial to be aware of the potential risks and to have support systems in place. Dr. Britton's research and insights shed light on the need for a more nuanced and informed approach to meditation, one that acknowledges both the positive and negative aspects of these practices.